and welcome to the Texas Children's Hospital Healthcare IT 101. We're really glad that all of you are participating in this hackathon. And we realize that some of you may not have worked in healthcare before. So we wanted to go over a couple of key concepts that are important in healthcare for you to consider while you're developing your hack. My name is Jacqueline Bernard, and I lead our custom application development team here at Texas Children's. I have two people with me to talk through some key concepts today. The first is Ashok Kurian. He's a director of enterprise systems, focusing on data and analytics, as well as some clinical applications. And we have John Westbrook, an assistant director of information security. And between the three of us, we're hoping to share some fundamental aspects of information technology across the healthcare industry. So with that, let's jump in. I'm going to ask the two of you the same question to start. Ashok, we'll start with you. If there is someone who's only watching the first few minutes of this video, what is the number one thing that you think they should know about building a digital tool for Texas Children's?
I think it's really important to understand not only, from a data source perspective, the fact that we have a lot of data here at Texas Children's, but also the end of it, right? So what the tool is going to actually do, it's going to help drive better decisions, going to make our patients' lives easier. And at the end of the day, it's the quality of care that's really important. But just to start, the very beginning is we do have an EMR here. We have it's a medical record tool by the name of Epic. We've had this for a little over 10 years now. It has every single encounter from a patient perspective in the history of Texas Children's in that environment. So about 4 million different encounters. So what that means is now we're able to now curate that data and then hand that over to our developers to build tools on top of it. So we don't do it as often enough now, but at some point we will. Now I will ask John to elaborate a little bit from a PHI perspective, because healthcare in general is a very conservative industry, and we protect that data really close to the sleeve. So
I guess that's a good leadway, right, Ashok? Is the biggest thing is how do we provide security, but we allow usability and functionality of those different systems that we develop, right? We always want to make sure we're protected from outside attackers. We take care of vulnerabilities and things of that nature. But at the same time, if you develop something that is so secure that the users can't use it and get the functionality that they need, then it's worthless, right? So it's a fine line on how do you tweak in between it to make sure you're protected, especially PHI, the patient health information. That is critical to us because that's a regulatory standard we are mandated to follow and protect.
Thank you. And I do want to dig into all of those topics in a little bit more detail.
Okay.
So let's start with the EMR, the electronic medical record. So this is one very big system we have at the hospital, which, as Ashok, as you mentioned, is sort of a source of truth for patient data, for historical information, as well as for our current patients that we're seeing right now. And of course, we also have a number of other systems in addition to this electronic medical record, right? We have smaller clinical systems and financial systems. In some cases, they stand alone. And in some cases, they can interface with or integrate with each other and that larger EMR. So not every system needs, to have everything because we can connect to the source of truth. So with that in mind, can you speak a little bit in your capacity as, our director of integration about how some of these systems can talk to each other, and what are some things to keep in mind if our developers need information or if they want to interface information into one of these other systems?
Yeah, sure. Thanks. So I think it's really important to understand the complexity of our ecosystem here. We have over 1,000 applications, and each one of those may have an integration point with other applications. So using Epic as an example, if you are trying to get information from your lab, there's a message that's sent. And that, from an Epic perspective, is typically through an HL7 interface. We do have business applications or business integration engines. The one that we use here today is Microsoft BizTalk, and that's really all of our non-Epic or HL7 data integration. So we use SFTP, REST, SOAP. We also have a medical device integration tool by the name of ConnectSol. So that's really, whenever you need to page somebody or get somebody's quickly using some of our other tools like Star 999, which is our internal, essentially it's our internal 911 system. We use ConnectSol. And so and now with the new project that we have coming along, it's the Oracle Integration Cloud. So that's another layer. So what's important to understand is that we started with one and now we have five, and it's becoming more and more complex from a landscape perspective because we're growing environments, and now you're talking about the cloud. It's not only on-prem systems, and so you have a lot more integration of data, and Epic may want to talk to the Oracle ERP, or we may want to share data externally with the third party or with another organization to improve care. And so it's really important that we focus on enterprise integration and understand and catalog what these point-to-point communications are. Because if we don't understand the data that's being exchanged or the data that's out there, then we're not going to be able to advance on our AI posture as well. So if somebody is out there and trying to develop algorithms for machine learning, they need to understand what their sources of data are. And so there are a lot of points. There are a lot of points of data out there. It's just a matter of collecting, categorizing, and then turning that on for development.
Yeah, and so I think what I'm hearing you say is the big takeaway is we have a lot of systems, and there are a lot of different ways they can talk to each other, whether that be an interface through an interface language like HL7 or others, whether it be an API or any number of other methods. And if the developers for this hackathon would like to take advantage of any of those integration opportunities, they're certainly there.
Yes, absolutely.
John, from your perspective, can we dig in a little bit more on protected health information? You mentioned PHI as being really important. And for folks who might not be familiar with healthcare, can you speak a little more to, first of all, what that is? And second of all, what that means from an information security perspective?
Yeah, the term is given to any health data that is transmitted, received, stored, that can contain 18 identifiers from as HIPAA, which HIPAA is our Health Insurance Portability Accountability Act of '96, which is our regulation we must follow. There's a privacy rule and a security rule in that consists of different areas, how we protect the privacy and what we need to do to protect the security of that PHI information. So with those in the slide deck that we're going to present, those 18 identifiers are out there. And what that really comes down to is those identifiers like zip code. Zip code could be an identifier on it because it comes from a system that is considered, PHI, right? It holds PHI and things of that nature. And that's where it gets tricky identifying what is PHI and what is not PHI. It depends on the system it comes from, right? On it. So without going into too much more detail on it, the slides really provide an in-depth, points of why. And, with PHI, if we had an attacker come in and we had more than 500 records compromised, it's a branding issue, right? We got to report to the media. We got to report to HHS, Health and Human Services, which is the state, right? And there's a lot of fines and things of that nature around it. And that's why security is so important for our PHI, for our patients, to have those controls in place. But like I said, it goes back to how much controls can you put in place and still have usability and functionality. And these are great conversations that, Ashok and I have all the time. It's always coming up, right? Every time a new application comes on board, he reaches out to me. We do basically a risk assessment around it, figure out if it hits we have about 27 questions on that questionnaire that, they got to have like a SOC 2 Type 2, which a SOC 2 Type 2 basically says that, hey, you have the controls in place and they're operating efficiently, and you're doing a report on it every 6 to 8 months on it, right? Another one is Hipaa compliance. These applications that come in, they have to be Hipaa compliance. Cloud, Ashok mentioned it, Cloud's a huge one right now. Is we've got some tools in place around our cloud to ensure that it is constantly HIPAA compliant, because when you put that PHI in the cloud, it's got to be segregated. It can't be in just the tenant and anybody can access it whenever it wants, right? So,
Yeah, and so if we are dealing in protected health information, and for everyone watching this, we will put a couple of information security specific slides on the website for your reference, including the list of what is considered protected health information. But for applications that do contain this PHI, I mean, there are a number of security things we need to consider, right? You named a few, but I mean, at a high level, we're talking about encryption if data is in
data at
motion
rest,
or at rest. We're talking about as well access or authentication. So how do people access the application? Are there any other big categories, or are those sort of the two key considerations?
We ask a lot of our vendors around security awareness and training. That's huge, right? Because with all the phishing attacks and things of that nature, we want to ensure that they have an awareness program, that they're handling some of those phishing, because how a lot of these phishing and malware really jump on into a system is they kind of go east and west, right? And they get admin privileges, which could possibly give you access to PHI information, right? So we want to make sure that training and awareness is there and it's established. That's one of the big ones that I can think of off the top of my head on it. We usually look at how much protected data, that could be PHI, that could be personal identifiable information, that could be proprietary information. So there's different regulatory standards around different pieces of that. There's a lot of legal contracts in place that we have. If you're handling our information, you got to have a BAA, business associates, I forget what
Business associates agreement with
agreement, yeah.
vendors.
Yeah, so that has to be in place to handle the data. We've got a lot of research in, which gets a little tricky around security and identifying data, and I'm sure Shuk can go into a little bit on that. But yeah, there's a lot of healthy conversations, and it's constant. And at the end of the day, it's about protecting our patients, right, and protecting their information.
Sure. Some of the, we have a number of categories that folks are developing for in the hackathon. I'm sure some people will be interested in patient information, and there might be some developers who are thinking about solutions that have nothing to do with protected information at all. For anyone who doesn't have, or who's working on a hack that doesn't include patient information or, other sensitive information, is information security still a big deal, or do we have more leeway there?
It's always a big deal. Anything that touches our network could possibly attach, or if say an attacker comes through, that they can traverse through. I mean, so it's always, we need to make sure that anything that touches our network is protected. It's got security controls around it, period. Because at the end of the day, like I said, it's about our patients and protecting those patients. And if we have somebody in our environment doing bad things, that could get very dangerous.
There are other categories of data as well that we care about. It's not only protected health information or PHI, but it's PII, so individual information. So information about our employees, or information about anything related to a person that's not a patient. That's also something that's really important from our perspective to protect.
Correct.
We don't want personal information out there. So.
Thank you. Ashok, I have one more specific question for you. I perhaps should have asked before, but I'll ask it now. We talked a little bit before about how it's possible to interface or integrate between systems, send data back and forth. We have sources of truth. And we talked at a high level about both interfacing and APIs, but are there any specific interface languages or API standards or other standards that we commonly use in healthcare specifically that might be different than folks are used to in other industries?
Well, we do have FHIR. FHIR is one of them. We do HL7. HL7 is it's a medical language of interconnection of data. So, but then we also have some common ones like REST and so. But really, it's HL7, FHIR. We also have interconnect. Interconnect is something from an Epic perspective we use to exchange data. But those are really the big ones there. But FHIR is one that's now I think a little more forefront, and people are using that to develop some APIs or use APIs and develop tools for that. So.
Thank you. From either of your perspectives, is there anything else you think is important for our developers to know that we haven't covered yet?
Well, I think from a perspective, just a very high level perspective, not necessarily a specific perspective, but there's a lot of opportunity here. There's a lot of data that we have. There's a lot that we don't do. We generally in healthcare are we go out and buy out of the box solutions, don't necessarily utilize some of the data that's available and build solutions to custom fit our needs. And so I think there's a lot of opportunity in this space to learn more about it, knowing that it is very conservative because at the center of all of it is patient information, and we do really care and want to protect that. But there is opportunity in this space to really provide improved quality of care. Start talking about AI and analytics and machine learning. I think it's an area that's really important.
Keeping it secure and protected. So I'm always going to preach that. It's always protected our patients, and it's all about that. So
that's great. Well, thank you both. Appreciate your insights. For those of you who are developing as part of our hackathon, we're so excited to see what you come up with. If you do have any questions about what you heard here today, please use the AMA form or the discussion tab to send us your questions, and we can try and get you answers. As I said before, we will also post a few slides specific to information security so that you can reference those as well. Thank you so much for participating in this event, and we can't wait to see what you build.